Hello, my name is Lori Badash. I'm a pelvic physical therapist and I work with Novant Health, Carolina's Pelvic Health Center. Welcome to part 3 of our video series for pregnancy and exercise. If you're watching this video, you're probably preparing for your postpartum period, or your baby is already here and you're wondering what to do next. In this video, we will teach you how to recover from pregnancy. We will discuss ways to safely exercise and care for your body after cesarean delivery as well. As discussed in the first video, there are many changes that your body experiences during pregnancy. Some of these changes continue into the postpartum period. This video will address some ways to deal with the various changes. First of all, your abdominal wall function is very important. During pregnancy, your abdominal wall had to stretch to accommodate for the baby's growth and now has become weakened and overstretched. Now that the baby has arrived, the abdominal wall will shrink back to normal size for the most part. If you have had a cesarean delivery, you will have a scar that has to be cared for to heal properly. We will discuss how to do this later on in the video. The perineum is your pelvic floor and it's below your bottom. You may have had a tear during the delivery, or you may have had to have an episiotomy. After the tearing, the doctor repairs the tissues, leaving a scar that has to heal. A muscle with a scar can be inhibited and weakened as a result of the injury, and we will discuss how to care for your perineum as well. In your spine and your hips, they also have to deal with changes too. Now that your baby is out in the world, they are going to get heavier. Staying in shape to prevent injury as you lift, carry, transport your baby is the key. Your back and your hips must be strengthened to carry the baby, the car seat, to transfer the baby here and there, and to walk around holding your child. Not to mention getting on and off the floor can be difficult with a cesarean scar. There are many exercises to do to strengthen your back and hips, as we will discuss later on in the video. While you are breastfeeding, your body will continue to release hormones that cause your ligaments to relax just like it did when you were in the pregnancy phase. Be aware of this and avoid rigorous stretching to prevent the overextension of your joints in your pelvic girdle. Now let's discuss the benefits of exercise and postnatal care for you and your family. First of all, exercise will help you lose your baby weight more quickly. You will have a more positive mood, more energy, more positive self-image from all the hormones that are released during your exercises. This will help reduce the risk of depression and anxiety now that your world is totally changed. Your body will sleep better when it is not so anxious and will improve your overall well-being. Not to mention, targeted exercises to work your pelvic floor muscles and allow them to recover reduces the stress incontinence issues that arise after pregnancy. Before we begin the actual exercise portion of our video, I must remind you that your body has undergone a tremendous stress to carry and deliver the baby. Please give your body a break and let yourself heal. I understand how hard it is to stop, rest, and enjoy time with your baby when it feels like there's so much to do all at once, but it's worth the time to relax when you can. Remember, it takes time for your body to shrink back to size. It took 7 months or so to stretch out, so give it at least 6 weeks to shrink back down. The last thing you need is an injury which inhibits you from doing your job as a mom, caring for your sweet baby, and caring for your family. Do not restart your prenatal exercise routine where you left off. Instead, start at the beginning with these basic exercises. The good news is that you can start some basic core strengthening 48 to 72 hours after delivery. These include the pelvic floor exercises, breathing exercises, relaxation exercises, and abdominal isometrics, just like we did in the first exercise video. This is true for both vaginal and cesarean deliveries. So let's start with the pelvic floor exercises to work the perineum. Whether you have a perineal scar or not, it is safe to perform these 3 basic exercises as long as you are not in pain. If you feel pain, start slowly with a few repetitions and build up as you can. Gentle exercise will help the healing process. So for your first set, start by lying down with your knees bent. Inhale slowly, and as you exhale, contract your pelvic floor and hold it during the entire exhalation. Start with 3-second holds and build to 5 seconds. Repeat this maneuver up to 30 to 40 repetitions as you're able to tolerate. For the second set, stay in the same position and perform quick and fast contractions in an on-off pattern. You can do 10 repetitions, rest, and then repeat that 3 to 4 times. This will help you contract the pelvic muscles quickly before you cough or sneeze, which will prevent a stress incontinence episode. For the third set of pelvic exercises, perform the elevator technique. Inhale, and as you exhale, perform 3 contractions in levels like an elevator stopping on 3 floors. You go up, 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 and then down, down, down. You want to do this 10 times, fully releasing at the bottom of the contraction. Once you feel these are easy, you can perform all 3 exercises in sitting and then in standing. It's best to find a convenient time, like when you're breastfeeding the baby, so you don't forget. These will help your perineum heal and recover from the trauma. After you complete the pelvic floor exercises, then you can move into the abdominal exercises. First of all, you want to hold your rib cage along the bottom rim. Inhale deeply and feel the rib cage widen. As you exhale, blow out all the air, flatten your tummy, and guide your rib cage inward and downward with your hands, like this. This will help shrink down your abdominal wall after the stretching from the pregnancy. You want to practice 5 to 10 times to build endurance. The third exercise you will want to practice is deep breathing. This will help you calm down and relax after dealing with the new baby and all the stress that comes with your life changes now. Lie on your back, close your eyes, and hold your hands over your lower abdomen. You want to inhale and feel your lower belly rise. Hold for 2 to 3 seconds, and then release all the air passively. Pause again before breathing in, and repeat for several minutes until you feel your body become heavy and feel your mind relax. It usually takes about 10 minutes for your body to calm down after being stressed, so be patient with this exercise. You can do this for the rest of your mommy life to deal with stress and anxiety. You want to continue the pelvic floor, abdominal, and breathing exercises up until the 6-week follow-up appointment with your physician. If you've had a cesarean delivery, it is safe and effective to perform the 3 exercises above. However, there are a few extra precautions to follow so that your scars heal very well. Remember, you have a higher risk for abdominal wall and pelvic floor issues, as well as chronic pain if these scars do not heal flexible. So protect your scars at all costs. Next, I want to show you some movement retraining ideas that can help reduce the stress along the scar tissue. After the baby comes, it's highly advised to have someone stay with you after this major procedure. You may need a parent as well as a husband because everyone will be tired. Have someone help you lift your legs for the first week if possible. They can also help you get in and out of the car, lift laundry baskets, grocery bags, baby carriers, so you can keep the stress off your abdomen. They can also help with nighttime feedings by bringing the baby to you so you can breastfeed while lying in bed. You only have 1 shot to recover from this surgery, so take it easy for the first 2 weeks and don't try to be a superhero by doing everything yourself. When you do need to move, try these techniques. When you're transferring, use a log rolling technique to keep your torso from twisting, and then sit up using your hands. When you're getting down onto the bed, sit down first, and then lie onto your side by your elbow. Slowly bend your knees one at a time to support your feet, and then log roll onto your back. Feel free at any point to brace your belly with a pillow during movement, or especially when you cough or sneeze. You may use an abdominal binder, which is a wrap that goes around your middle to help keep compression along your abdomen when you're walking around. You can support your abdomen when bending and moving using your abdominal wall contractions, which we called hug the baby contractions in earlier videos. This will keep the scar from pulling apart and help it stay healed. When you're sitting, you want to sit in a very tall posture that keeps the scars from shrinking too short. When you lift the baby out of the crib, it's best to have a step stool next to the crib to put your foot up onto. This will help decrease the load across your abdomen as well. Please avoid lifting anything heavier than the baby for the first 10 days. It is recommended and safe to perform pelvic floor exercises, breathing, and abdominal contractions as we discussed earlier. You can also start these 2 to 3 days postpartum as long as you're not having terrible pain. It is also acceptable to start massaging your abdomen 3 to 6 inches away from your scars to help promote circulation. All these things seem like a lot to do, but the time and effort is worth it in the end if your scars and your abdomen heals well.